Stages of acute suppurative otitis media. There are total 5 stages. First stage is a stage of tubal occlusion. Here, edema and hyperemia of the nasopharyngeal end of the eustachian tube, which leads to blockage of the tube and results in absorption of the air and negative intratympanic pressure. Symptoms: deafness and earache. Signs: tympanic membrane is retracted, prominence of the lateral process of the malleus, loss of light reflex, tunic fork test show conductive deafness. Next stage is a stage of presuppuration. Here, if the tubal occlusion persists, pyogenic organisms invade tympanic cavity and results in hyperemia and inflammatory exudates appear. This inflammatory exudates makes the tympanic membrane congested. Now, symptoms: marked earache, deafness and tinnitus, fever and restlessness seen in children. Signs: congestion of the pars stensa, cartwheel appearance of the tympanic membrane, and tunic fork test show conductiveness. Stage of suppuration. Marked pus formation in the middle ear and the mastoid is seen here, and the tympanic membrane starts bulging to the point of rupture. Symptoms: excruciating earache, deafness increases, fever of 102 to 103 Fahrenheit seen in children, which is accompanied by vomitings and convulsions. Signs: tympanic membrane is red, bulging, and with loss of landmarks. A yellow spot is seen on the tympanic membrane where rupture is imminent, and tenderness over the mastoid. X-ray mastoid shows clouding of air cells. Stage of resolution. Tympanic membrane ruptures with the release of pus and subsidence of the symptoms. Signs: earache is revealed and the fever comes down. Signs: small perforation is seen in the anterior inferior quadrant of the pars stensa, and hyperemia of the tympanic membrane begins to subside. Stage of complications. Due to high virulence of the organisms or poor patient resistance, there is no resolution of the disease and it spreads beyond the confines of the middle ear and results in complications like mastoiditis, petrositis, extradural abscess and facial